Diagnosis. When a physical examination is performed for another reason or during normal medical exams like an ultrasound of the heart or abdomen, abdominal aortic aneurysms are frequently discovered. A doctor will evaluate you and look over your medical and family history to determine whether you have an abdominal aortic aneurysm. Imaging tests are performed to confirm the diagnosis if your doctor suspects you may have an aortic aneurysm. The following tests are used to identify abdominal aortic aneurysms. Belly ultrasound. The most frequent test to identify abdominal aortic aneurysms is this one. An abdominal ultrasound is a non-invasive procedure that employs sound waves to visualize blood flow through the aorta and other abdominal organs. A technician moves a transducer, ultrasound wand, back and forth against the abdomen while performing an abdominal ultrasound. The gadget communicates with a computer, which generates visuals. CT scan of the abdomen. X-rays are used in this painless examination to produce cross-sectional images of the structures inside the abdominal region. It is employed to get precise pictures of the aorta. The size and shape of an aneurysm can also be identified via an abdominal CT scan. You recline on a table that slips inside a donut-shaped machine during a CT scan. Occasionally, dye, contrast material, is injected into a vein to enhance the visibility of your blood vessels on the photographs. Stomach MRI. A magnetic field and radio waves produced by a computer are used in this imaging test to provide finely detailed images of the internal organs in your abdomen. To make your blood vessels more apparent, dye, contrast material, may occasionally be administered through a vein. Screening for abdominal aortic aneurysm. Smoking and being a man both greatly increase the risk of developing an abdominal aortic aneurysm. Screening suggestions can vary, but generally speaking, men aged 65 to 75 who have ever smoked cigarettes ought to undergo a single abdomen ultrasonography screening. A clinician will determine the need for an abdominal ultrasound for males aged 65 to 75 who have never smoked based on other risk factors, such as a family history of an aneurysm. For women between the ages of 65 and 75 who have ever smoked cigarettes or have a family history of the condition, screening for abdominal aortic aneurysms may be useful, but the available data are insufficient to make that determination. Ask your doctor whether an ultrasound screening is necessary based on your risk factors. Women who have never smoked should not typically be evaluated for the condition. Treatment. The aim of treating abdominal aortic aneurysms is to stop the aneurysm from rupturing. Surgery and cautious monitoring are two possible treatments. Depending on the size and rate of growth of the aortic aneurysm, you may receive one of several treatments. Medical monitoring. If the abdominal aortic aneurysm is modest and not causing symptoms, a doctor may advise this course of action, sometimes known as watchful waiting. In order to monitor the aneurysm and treat other diseases, such as high blood pressure, that could exacerbate it, regular medical visits and imaging tests are necessary. A minor, symptomless abdominal aortic aneurysm patient often requires an abdominal ultrasound at least 6 months following diagnosis and at routine follow-up visits. Surgery and other procedures. An abdominal aortic aneurysm should often be repaired surgically if it is 1.9 to 2.2 inches, 4.8 to 5.6 centimeters, in diameter or bigger, or if it is expanding rapidly.
For any questions, leave a comment below and don't forget to subscribe.